The Ministry of Health, with support from Center for Disease Control through Infectious Disease Institute, commissioned the Westnile Regional Public Health Emergency Operations Center at Arua Regional Referral Hospital on Wednesday, which will help to identify, respond, and investigate the public health threats in the region.
In July 2020, you remember we had the catastrophe, the COVID pandemic, which outstretched the capacity of the national capacity to really control COVID. And we found that the center, which had tried to stem the transmission, was too far away from the ground or from the dynamics and events on the ground. So at that time we needed more than one jurisdiction operating under a single command and control system so that we can stem or control COVID.
Our level of support with COVID, and it's taken us in very interesting directions. I think what's noticed most often is the financial resources that the U.S. government and CDC contributes to Uganda, but I want to take a moment to emphasize that for us, it's actually the technical exchange that is the most valuable, and I believe that is also seen and felt on this end as well.
The center has been welcomed by both the technical and political leaders of the region.
Today, we would have one such emergency operating center launched in Westnile. As we launch it, we need to develop it to a much bigger level in form of human resource, especially the required coordination, because upon this emergency operating center, we are also bringing in the emergency medical services, especially ambulances coordination.
And let me thank the ministry for this wonderful work. Let me also thank the ministry for the OPD and the accident center that is about to be completed. That's a very wonderful project, and we appreciate what the ministry is doing. I want to appreciate the public health laboratory work that's going on. It has delayed, but it's going to pull up the hospital to a much higher level.
On behalf of WENDA, to welcome this good initiative and pledge our absolute commitment to support this goodwill and offer our political support and will to have this realize the dream and the purpose for which it is being commissioned.
The Central Division MP Jackson Lee Atima said there is need for the government to work on road infrastructure and connect the region to the national grid for the facility to serve the interests of the people of West Nile and Uganda at large.
If we, as government, do not work on this road which comes from Karuma to Arua, Honorable Minister, it's unfortunate you flew this morning. If you had come on this road, you will have attested, witness to what I am saying. That road is so terrible. We used to take 6 hours from Arua to Kampala. Now we take 9 hours or 10 hours. Many motorists have chosen to go through the park. From Karuma up to Arua, the road is completely destroyed. So government should do something because ambulances have been breaking on that road. Health emergencies can't be helped. So if we are launching a facility that is to help and save life, we need to work on that road, Karuma to Arua. 2, what facility we are setting here needs electricity. Honorable Minister, I know every week you have cabinet meetings, you say among yourselves with the Prime Minister, with the President, and colleague ministers. Please add your voice on ours to the Minister of Energy that West Nile needs to be connected to the national grid so that what you are launching today can be a success.
The Director General of Health Services, Dr. Henry Mwebesa said the center will provide early warning signs for public health events. It will coordinate preparedness and response efforts.
The point I want to emphasize here is that for you, especially our political leaders and community leaders in this region, is that this center will be an early warning sign. From this center, we are able to pick the problem before it gets out of control. We pick the outbreak very early, but it also helps us to coordinate. We'll be able to coordinate the response and keep monitoring the trends. If there's an outbreak here, how is it moving? What are the numbers? How are we managing it? So they will really coordinate the response in a unified way. And I think that was brought up very well by this. It will be an opportunity for good information sharing. When there is an outbreak, there will be monitoring, so they will be preparing us, and that's the preparedness phase, which is talked about. But when there's a problem, they will trigger the response. And I think also that came out very well.
Meanwhile, the Minister of Health in charge of general duties, Bagriana, Anifa Kawoya, who was the chief guest during the commissioning, appealed to the people of Westnile to embrace the project to help fight public health threats.
For the people of our community, Westnile region, we thank you. This project we have commissioned, we have made commission is your project. Take it upon as your project. You must own it. Thank you so much.
The Westnile Regional Emergency Operations Center was established in March 2021. Staff were trained and mentored under the guidance of the Ministry of Health, Westnile Region Steering Committee on Preparedness and Response, supported by Center for Disease Control through Infectious Disease Institute, Makerere University, under the Global Health Security Program. For Westnile TV, I am Dennis Oringi reporting.